Hello friends, I am Dr.Abhijit Kulkarni, consultant brain and spine surgeon. Today we will discuss about awake craniotomies. So what is a craniotomy? Craniotomy is any procedure in which a portion of the skull bone is removed in order to access the intracerebral clots or lesions. In this procedure, multiple holes are drilled into the skull and then they are connected in order to remove a portion of the skull bone. Now, can you imagine if I tell you that I have done multiple awake craniotomies? Whenever there is a lesion in eloquent areas of the brain, that is, areas which control important function like vision, speech, limb movements, preservation of these functions after surgery is as important as removal of the lesion. In such cases, if the patient is awake or understanding our commands, then we can assess intraoperatively only if any function is getting compromised and stop before the patient lands up in any permanent neurological deficit. This is the principle of an awake craniotomy. In an awake craniotomy, first the patient is sedated. General anesthesia or intubation is avoided. Local scalp blocks are given. The craniotomy as well as opening of the dura or the covering of the brain is done while the patient is sedated so that the patient does not perceive any pain. After the dura is opened, the sedation is stopped and gradually the patient is awakened. The brain matter does not have any pain sensation of its own and hence removal of the lesions from the brain does not cause pain to the patient. Intraoperative monitoring can be used to assess function. Also, once the patient is sufficiently awakened, we can ask the patient to perform certain tasks so that we can assess the function which we are trying to preserve.
आंटी, दाया पैर ऊपर उठाइए, नीचे रखिए, पंजा ऊपर नीचे कीजिए। ओके, अभी बाया पैर। ओके, नाम क्या है आपका?
During removal of the lesion, if that function like speech or limb movements is getting compromised, then we can electively choose to leave a bit of the lesion in order to preserve function. Thus, all in all, an awake craniotomy helps us to remove lesions or tumors from eloquent areas of the brain while still allowing us to preserve function post-operatively. Thank you.